Premature babies are extremely delicate. Even small knocks can cause extensive damage. A caesarean delivery is considered less traumatic for the baby than a normal birth.
First of all, we deliver the legs and the bottom, which is coming out very easily.
Once the legs and body have been delivered, the womb, which is still quite small, tends to clamp around the baby's head, making it very difficult to get the baby out.
I'm starting to get a little concerned now. It's taking quite a long time to get this baby's head out, longer than we would normally like. I'm starting to get a bit worried that this might cause problems to the baby.
At last the baby is delivered, but there's hardly time to tell the parents they have a baby girl before she is rushed over to the paediatrician.
It took quite a long time to get that baby's head out, and as we handed the baby over to the paediatrician, I was really quite concerned as to how the baby was going to go and what state it would be in.
The first job is to get the baby breathing by connecting her to a ventilator.
How's baby? Baby's fine. Nice and pink and vigorous and breathing for herself, but needing a lot of effort to breathe. And so I think would almost certainly have tired very quickly if we hadn't actually kept her ventilated.
The length of time it takes to get the baby's lungs working is critical. If her brain is starved of oxygen for too long, it will certainly be damaged. For Mr. and Mrs. Partridge, the joy of the birth is mixed with the fear that their new baby could be brain damaged. In any event, baby Sally faces weeks in intensive care.
They ran through everything and told us pretty much straight about the problems the baby could have later in life being premature. But as each day goes on, then they said the better the chances will be.
How well a baby will do depends largely on how premature it is. Less than 10 weeks early and babies generally do very well. More than 12 weeks premature and the chance of long-term damage is much higher. It's possible to check the development of a baby while it's still in the womb using an ultrasound scan.
We're doing a scan now on a lady who is 20 weeks pregnant with her first baby. 20 weeks is halfway through her pregnancy, and if all goes according to plan, she's got another 20 weeks to go before the baby will be born. At this stage, all the baby's organs are formed, and the baby has everything that it will have when it's born. However, at this stage, the baby can't survive. If it was born now, it would be too small, and it couldn't survive because the organs aren't mature. However, in only 4 weeks' time, at 24 weeks, this baby would have a chance of living if it was born. It would need an awful lot of help and an awful lot of support, but it does have some chance of surviving.
The basic problem for premature babies is that the world outside is very different to the environment they're used to inside the womb.
Before a baby is born in the womb, they're exposed to a very steady, constant environment. This means that their temperature is kept stable, they're fed at a steady rate, and their breathing is done for them. When the baby is born, this terminates abruptly.
Once the baby is born, the medical team try to recreate a stable environment that is as close as possible to the environment inside the womb.
It usually comes as quite a shock to see how much equipment is necessary to do for a baby what was done for him in the womb by his mother. This silver probe is a temperature sensor, which is continuously measuring Jack's temperature. And he is under a heater. If he becomes cold, the heater puts out more heat. And if he becomes too hot, the heater reduces the amount of heat that he's getting.
Jack also needs the fluids he would have received through the umbilical cord from his mother. And these are provided through a series of pumps.
This pump is infusing fat. This one has got a sugar solution. This is pain relief. This is one of the drugs that's maintaining Jack's blood pressure. And up here, we have more nutrition, and this contains a protein and a vitamin solution. We're also having to breathe for Jack because his lungs are very, very immature. The ventilator is breathing for him and is providing him with oxygen and is removing carbon dioxide.
Despite the effort of doctors and nurses, Jack died after just 11 days. Sally Partridge, who had been in the womb 5 weeks longer than Jack, is now making good progress.
Baby Partridge is now 4 weeks old. This means that it's still 6 weeks before she was due to be born, because she was born 10 weeks early. Her main problem now is that she still requires a little bit of extra oxygen to help her breathing, and she clearly needs to grow, but she's making very good, steady progress, and I would expect for her to be going home in about 2 to 3 weeks' time.
As Sally gets stronger, she can be held in her mother's arms. She looks like a small but normal baby, but she may have long-term problems which are not yet apparent. In America, a study has been made of the problems faced by premature babies as they grow up.
Over the course of the next year or two, certain problems do become obvious, and particularly in the area of developmental difficulties. We know that many premature babies have difficulty in terms of the coordination of their fingers and their hands, so that they have difficulty holding a pencil, manipulating objects. Other prematures will have difficulty in terms of walking or sitting or standing, and they may be clumsy or they may be awkward in how they do these things.
By the age of 2.5, most children can use scissors reasonably well. A 3-month premature baby at the same age doesn't have such fine control of their hands and has great difficulty with coordination.
Some premature babies will have difficulty in terms of speech and language, not only finding the word in terms of spontaneous speech, but in understanding what people are actually saying to them.
Many premature babies also have difficulty with their eyes, not only in actually seeing objects, but also in coordination. The more premature the baby, the greater the risk to its quality of life. So should we continue to help ever smaller babies to survive?
As neonatal intensive care has got better and better, babies below 28 weeks have begun to survive, and so recently the law has changed so that a baby is now thought to be viable when it's 24 weeks or more. But in reality, between 24 weeks and 28 weeks, the chance of a baby surviving is not that good, and the chance of it surviving and not being in any way handicapped is very small indeed.
It used to be thought that babies who were born more than 12 weeks premature were unable to survive. We now clearly know that this is not the case. At the moment, babies who are born up to 16 weeks early clearly do survive and do grow up to be healthy children. It may well be that in the future, babies of even greater immaturity who are born even earlier will be able to survive. But for the moment, the only sensible way to approach the problem is to treat every single child as an individual in their own right.
At some point, someone has to make some type of decision to say how small is small and how can we save all these babies. If I had another baby that was smaller than Danielle, I'd really, really have to think hard and make a decision about whether or not I would think that we'd be able to save her and keep her alive, because I don't know what kind of quality of life she would have.
We had a call earlier this evening about a baby with severe breathing difficulties in a hospital about 5 miles from here, and we have just sent out our transport team to bring the baby back to the hospital, where we can offer a very specialized form of respiratory support.
Can you just tell CICU we're coming? Sorry?
Although baby Nubian was born at the right time, there were complications during the birth which damaged his lungs. Without sufficient oxygen reaching his brain, it will almost certainly be damaged. The operation to connect him to the machine is dangerous, but without it, he will certainly die.
This is a baby who developed severe breathing difficulties immediately following birth as a result of breathing contaminated fluid during the final stages of the birth process. There are 2 ways in which babies like this can be supported. One is to attach them to a lung ventilator life support machine, which blows air and oxygen at high pressures into the lungs.
Nubian's lungs are too badly damaged for this treatment to keep him alive, so the doctors have decided to bypass his lungs altogether.
What we've done here is put a tube into the baby's vein to take blood with little oxygen in it from the baby down into a reservoir. This reservoir is a safety device which prevents the baby being completely emptied of blood by switching off the pump of the circuit. Blood then passes from the reservoir round into the pump itself and then into the artificial lung, which is made of a large sheet of silicon membrane which is wound in a spiral.
Blood passes through the artificial lung on one side of the membrane, with oxygen-enriched air flowing past on the other side. The membrane won't allow blood to pass through, but is permeable to oxygen. As the blood flows through the lung, it becomes fully loaded with oxygen.
Because blood has then cooled down to below body temperature, it passes through a heat exchanger with the blood, which has then been rewarmed and has a full oxygen concentration, passes back into the baby through a second tube, which this time passes into the arterial circulation of the baby.
While Nubian is connected to the machine, it's impossible for his parents to hold him. This places a terrible emotional strain on them.
Okay. As much as you can stroke him and talk to him and touch him, I think that's better for him. It also is nice for you because it allows you to have some sort of contact with him in this sort of intensive care type situation. I think when the parents see them, it's very difficult because their chest isn't moving and suddenly they notice it and it can be very scary for them. So although he's attached to the ventilator isn't doing anything at all, and he is depending totally on the machine for all his lung function.
4 days later, Nubian's physical condition has stabilized enough for further tests to be carried out. The results from a brain scan show that the trauma of his birth had starved his brain of oxygen.
It became clear that severe and irreversible brain damage had occurred. In consultation with his parents and with the other members of staff, it was decided that we would withdraw all the special support systems. This was done, and soon after, Nubian died in the arms of his parents.
One group of babies at high risk of being born early are twins and triplets. Such multiple births are often the result of fertility treatment. Twins are relatively common, but triplets are much rarer.
This is a lady who's had fertility treatment. She's had some drugs to cause her ovaries to produce eggs. When you have this sort of treatment, there's a small risk that you'll have a multiple pregnancy. It doesn't really matter if you have a twin pregnancy. I guess if you've waited quite some time to get pregnant, to have twins is not a problem. And triplets are not a great problem. But if you have more than triplets, then the risks to the babies, the risk of them being born prematurely is really unacceptably high. When you have triplets, one of the problems is that the babies may not grow as well as a single baby would grow. She's now reached the 32nd week of her pregnancy, and we found that one of the triplets, triplet number 2, wasn't growing as well as it had been up to now. And since it's got to 32 weeks, and at 32 weeks the chance of the baby surviving is extremely high, we decided that the best thing to do was to deliver them.
All fertility treatments work in basically the same way, by interfering with the normal menstrual cycle. Drugs are used to cause the ovaries to produce more egg follicles, so the chance of fertilization is increased.
In normal menstrual cycle, one egg is produced in one follicle each month. But this woman has had fertility drugs, and so she has numerous follicles, each of which should contain an egg. That area which shows up as black on the screen is actually follicles in this woman's right ovary. They're a little bit like balloons, each being blown up within a small space.
A needle is pushed into each follicle in turn, and the egg is flushed out. This process is repeated for the other follicles. The embryologist checks how many eggs have been collected before they're ready to be mixed with the sperm from the father. In test tube treatment, fertilization happens in the laboratory. 2 days later, the eggs have developed into embryos, each containing about 4 cells. Only 3 embryos are ever put back at a time to reduce the risk of multiple births. Any left over can be frozen in case the first attempt doesn't work. But the latest treatments attempt to make fertilization happen within the woman's body.
What we have here is a lady going to have egg collection for a technique called gift treatment. And in gift treatment, we're putting the eggs and the sperm back into the natural environment, that's the fallopian tube, at the time we collect them, hoping that conception will occur in the fallopian tube rather than with test tube treatment in the laboratory.
The operation involves passing several instruments through the wall of the abdomen. The surgeon then uses a television camera to perform the operation.
There it goes. Now it's empty.
Once the other organs have been pushed aside, the ovaries appear, white and swollen to either side of the womb. The eggs are then collected in the same way as for test tube fertilization.
The embryologist has now got 3 eggs. Have you got 4 or 3? He's got 3 eggs. Inject again. He's going to put the eggs into a culture medium in the dish, clean them, then he's going to inseminate them with the sperm the husband's already produced. And in a little tube, you'll watch it later, we're going to put the egg and sperm back down the end of an open fallopian tube.
The fallopian tube usually collects a single egg from the ovary and transfers it into the womb. With this treatment, 3 eggs, already mixed with sperm, are injected directly into the fallopian tube.
No, I haven't.
So you can, why don't you...
Injecting now.
Yes, inject now.
The woman then has to wait and hope that the eggs are fertilized and develop into a pregnancy.
The anaesthetist is just putting the epidural in now. That's a sort of anaesthetic, which means that people can have their babies while they're awake, but without feeling any pain at all. And I think they're ready for us to start now.
All right, steady here, hold it.
Head of number 1.